I'm Richard Ugbena, so I'll be presenting on partner notification services among HIV positive key population, an important strategy towards achieving UNAID 1990 goal by 2020. This study is actually an analysis of public health intervention by one of the PEPFAR implementing partner in Nigeria. The partner provides both HIV prevention, treatment and care services for key populations, including HIV counseling and testing. This presentation actually followed the guideline that was provided for this conference, starting with the summary. The analysis of the project data file indicated that HIV prevalence among key population partners is about 6 times higher than the key population themselves. Below, you can see, sorry, how do I navigate my next page? Okay. Hello, can you hear me?
Yeah, everyone is hearing you.
Hello?
Yeah, everyone is hearing you. You can speak.
Okay, fine. So the analysis showed that HIV prevalence among partners of key population is 6 times higher than the key population themselves. Key population are those people classified as most at risk of HIV prevention because of their behavioral and social and legal issues that increase their vulnerability to HIV infection. The schematic diagram below shows the importance of partner notification among partners of HIV positive index. The first cycle by the left at the center is an HIV positive identified either in health facility or in the community services that carry out counseling and testing, and is identified to be positive. Now, the thing with key population is that there is usually a sexual network among the key population. So for this particular index person who was identified as positive, he has other multiple partners who are not yet identified. They may be in the community or anywhere. So partner notification services try to identify who these people are so that they can bring them into treatment services in the bid to make sure that we achieve the control of HIV infection by 2020 and then elimination by 2030. Now, key population, like I said before, these are a group of persons that are disproportionately have a higher burden of HIV in any setting because of the legal and social issues that increases their vulnerability to HIV infection. And key populations are classified into 4 different categories: the men who have sex with men, the people who inject drugs, the female or male sex workers, people in prison, and transgender people. In Nigeria, the prevalence of HIV among MSM, brutal-based FSW, female sex workers, and people who inject drug is 23%, 90.4%, 8.6%, 3.4% respectively, compared to the national prevalence through the National AIDS and Reproductive Health Survey in 2012. The higher prevalence of HIV among the key population, particularly the MSM, means that this population will continue to drive HIV spread in the country. In 2016, UNAID set a universal goal of 1990 to control HIV epidemic and elimination by 2030. The goal states that 90% of all those who are infected with HIV infection should be identified, and out of those people who are identified as positive, 90% of them must be linked to treatment, and out of the 90% linked to treatment, 90% of them should be retained on treatment and achieve viral load suppression, which is also key to control HIV infection and spread. So to achieve the first 90, which is identification of new cases, means you have to intensify case finding. Now, in Nigeria, acceptance of HIV testing among general population is just 76%. It's even worse for the key population, which is 54% among people who inject drug, Men who have sex with men 65%, and female sex worker is 80. Sorry, this is not showing clearly on mine. It's above 80%. So PNS has been identified as an innovative approach that help to reach the sexual network of the key populations. The objective of this study was to describe the level of acceptability of partner notification services among key populations using the various approaches for PNS services. Now, HIV partner notification services is actually a voluntary process where trained workers, health workers, including lay provider, ask people diagnosed with HIV about their partners or drug injecting partners, and with the consent of the HIV positive person, offer these partners voluntary HIV testing to determine their HIV status. PNS, this is not the first time partner notification services have been utilized. It's been utilized for other STI and as well as TB. But when HIV intervention started, our focus was more of community counseling and testing, health facility-based counseling and self-testing. So it is now we are just thinking about introducing partner notification services. Now, because of the issue of discrimination and stigma among key population, getting them to disclose their status to their partner and then getting in touch with their partner to test them for HIV testing is really a challenge. Given these circumstances, it's more difficult for HIV to disclose their sexual orientation to their partner. However, the benefit of partner and couple testing has been well documented. And for HIV, it includes mutual support to access prevention services, treatment services, as well as improve adherence and retention in treatment and mother-to-child transmission of HIV. Partner notification services also identify for couples or partners where one is negative and the other one is positive. They will be able to, if there is disclosure between two of them, they'll be able to support themselves in terms of taking critical decision as to when to use condom, how to encourage the positive person to go ahead with their medications, adhere with their medications, and for the negative person to utilize the options that are available for pre-exposure prophylaxis. Now, it's been found out that with partner notification services, or rather what is key, looking at the first diagram that we saw, with partner notification services, we should be able to identify a lot more hidden cases if we are really serious about the control of HIV/AIDS by 2020. This study is a descriptive study using routine program data. All HIV patients receiving services in the 7 one-stop shops, which is a community-based services, will offer partner notification services between April to sometimes in July this year. All the patients who accepted partner notification services were asked to provide a list of their partners and notified and then test them for HIV. The patients also agree with the healthcare provider the best approach to be used in reaching their partner. At each of those service points, the one-stop shop, there's a partner notification service register which was used to capture the characteristics of the patient, their partners, and outcome of HIV testing among the partner. Data was abstracted from the service register by the facility record, who is also trained on the data abstraction. Patient data was identified using the partner notification ID. The researcher, there was no point of contact of the researcher with the individual that were entered in the register. The result, we found that during this period, 36,379 key population were tested for HIV over 3 months, with 2,486, that's 7% prevalence among the key population. Out of the 2,486, only 846, that's 34% of the positive client accepted partner notification services. In other words, once somebody is identified as positive, is offered the option of partner notification services, and if he accepts, then the healthcare provider can discuss with the person on the mode of meeting their partner to get them tested. But for this study, only 34% of those who were identified positive accepted partner notification services. Of the 846 that accepted partner notification, all of them were only able to list 938 partner. This means that one index case might list more than one partner, just as we saw in the schematic that I earlier showed, with one person having multiple partner. Now, okay, better. So HIV prevalence among partner was 45% compared to the 7% among key population. This is about 6 times more than the prevalence that is found among key population. And like I said before, in all settings, key population themselves have disproportionate high burden of HIV prevalence. Now we are finding out that their partner even have more HIV prevalence. Now, out of those 123 of the partners who tested positive, out of the 422 partners who tested positive, 129 of them were already known positive, with only 61% of them on ART, on treatment for HIV. The remaining 39 were also, the program made effort to link them to treatment. Now, we found that various